Yeah, so thanks for bringing me on. Really excited to talk to you all today about my research and a bit about the clinical anatomy program. So, again, my name's Kody, and I'm a clinical anatomy master's student. And let's get started. So, a bit about me is that I did my undergraduate degree in life sciences at McMaster University. And so, it was there I kind of developed an interest in sciences and anatomy, and that anatomical interest has kind of led me to my interest in medicine. And so, it's just a picture of me and my friends in the life sciences program. And so now, as you've known, I've transitioned from a Marauder into a Mustang, and I'm really excited to be here. Um, Personally, a bit about me is I'm a big fan of Attack on Titan right now. Really cool show that I've been interested in. Big Raptors fan. If you ever want to talk about how garbage they are, feel free to email me. And here's a picture of two of my favorite people. Granted, one of them is a dog, but I still love hanging out with them nonetheless. So it's just my girlfriend and my dog, Stanley. So, how did I get into research? And I'll talk to you about the clinical anatomy program. And so, as I've said before, I have an interest in medicine. And originally, I didn't really have an experience in the research field. But a big requirement of medicine is to have some sort of research background. And it was at this point in my undergrad where I was a little unsure of my career path. And I did have an interest in chemistry. So, I kind of wanted to expand and see what other fields are like. So I ended up joining the Mark J. Adler research lab at Ryerson University, where they study organic and inorganic chemistry. And this picture was taken at a local conference at Ryerson University called Science at the Interface, where we presented data from our paper. And so this is me in the lab. I did a lot of data collection. We were investigating compounds or molecules called porphyrin silanes. Porphyrins are a naturally occurring molecule. They actually constitute the heme group of blood. And so what our lab did was we attached two silicon atoms to it, and that allowed us to then attach a variety of different other substituents to those silicon groups. And so I did a lot of data collection in terms of UV and visible light spectroscopy. I did fluorescence spectroscopy, but mainly what I did was cyclic voltammetry, which was super satisfying because all day and every day I would just develop these graphs. And you know that these graphs ran a success if you get this duck shape. And so I love doing that every day. And so what cyclic voltammetry does is it measures the redox potential or the reduction and oxidation potential of a molecule. And so we were identifying if the redox potentials could be used in standard reactions. So if we can use porphyrin silanes as a substitute for a lot of different reagents used in a lot of classic chemistry research protocols. And overall, we saw that adding these silicon groups kind of flattened out. So they increased the planarity of this porphyrin silanes and increased their solubility subsequently. And so because of that, I actually got my name on a paper, which was really unique and doesn't happen very often. So I was really proud of that. And so this was the title if you wanted to go read about organic chemistry. Or actually, this was submitted to inorganic chemistry because we attached silicon groups, which are naturally occurring. And then, so from there, I realized I wasn't an organic chemist. I didn't really foresee myself going too far down that field. So instead, I joined the McMaster Arthroplasty Collaborative, where with a fellow orthopedic surgeon named Dr. Separek Tiari, we were doing a systematic review of total hip arthroplasty, which is basically a double hip replacement, so on both sides. And specifically, we were looking at the direct anterior approach versus the posterolateral approach, so from the front or from the behind/side. And so after going through articles and picking out data, extracting from each one, we realized that there wasn't enough data that compared the two. And so it was highlighting a gap in the literature. So this kind of taught me about how sometimes research just doesn't pan out, even though you've identified a really cool area that, you might just have to do some more digging or more research into the subject. And so from there, that led me to this program, the Master's in Clinical Anatomy. And before I get into my current research, I'll talk to you about the Clinical Anatomy program, and specifically the three things that kind of drew me to this program. So the first being dissection labs, second being TA experience, and the third being my research project. And so our dissection labs, we have them twice a week. We're tested by biweekly bell ringers, and we get to explore the human body using cadavers. So it's 2 people to each cadaver, and we investigate regions of the body. So first we did head and neck, and then we did the thorax and the back. And currently we're dissecting the musculoskeletal system, so the upper limb. And so this is a picture of me in the clinical anatomy cohort. There's only 8 of us in the program. And I know, yes, it does look like we're an underground anatomy rap group. And if you were wondering, our mixtape is dropping very, very soon. So be on the lookout for that. In terms of TA experience, this program, the Master's in Clinical Anatomy program, it was originally designed to breed a new generation of anatomical educators. And so they have a really big teaching component to the course. And so for those of you who might know me, I taught 3200 last semester, functional neuroanatomy. This term, I'm teaching 2200 systemic anatomy, and I'm also head TA along with a few other clinical anatomy students in 1330 human anatomy for nursing students. And what's really cool is of all the teaching experience we get, and because of one of our classes we call professionalism, we actually complete components of the teaching certificate enough to actually receive one at the end. So we get certified in teaching at Western, which is pretty interesting. And so what drew me to this research project as well, in addition to the dissection lab and the teaching experience, is that typically you match with a supervisor before entrance to a master's program. So you have to go out and investigate labs and try to get interviews with people and try to get a spot in their lab. But the clinical anatomy program is unique as it only offers the projects 1 month after first semester begins. So we kind of have enough time to get our feet wet with dissection labs and all the other courses. And so then we have 8 to 9 projects offered to us. We get to read about each one, see what interests us, and then we can interview with as many or as little supervisors as we want. And then based on our interviews, we rank the projects in terms of how interested we are. And then the supervisors rank us in terms of how good of a fit they think we are. And then if our rankings align, then you're offered a group. And so currently I'm with Dr. Tim Wilson, and I'm excited to begin my research. And so I'll talk to you a little bit about that now. And so the best way I think to talk about my research is to give you sort of an analogy at first. So imagine you have a car, right? And you drive the car every day, and this car, day in and day out, it works perfectly fine. You've had no issues. But one day, a small sound starts to emanate from the car. And at first it's unnoticeable, but the more you drive the car, you realize that the sound is getting louder and louder, and eventually gets so loud that it's distracting. So you turn on the radio to drown it out. But then it gets even louder than that, and it becomes more apparent even with the radio on. And so it becomes a hazard at this point. So you actually have a police officer stop you, and the police officer tells you, hey, that noise is very loud. It could be very dangerous to you. And so if you didn't listen to the police officer, the noise would get so loud that it can actually run you right off the road, and you would crash, unfortunately. Very sad. So to avoid that from happening, you listen to the police officer and you go to get your car fixed. So you go to a mechanic, and the mechanic tells you, okay, I'll fix your car, leave it with me for a day or two. And then afterwards he fixes your car and he says, listen, I fixed your noise, but the only way for us to tell if I've actually fixed the noise is to monitor the car and see if the noise comes again. And you think to yourself, well, that doesn't make a whole lot of sense. Why am I just going to wait around listening for the noise? Like, how do I know if this worked? Why would I just waste my days just waiting for this noise to come back? And so our group is proposing that we can figure out a way to allow the mechanic to quantify the noise reduction. So for example, the mechanic hopefully would be able to fix the noise and say, we've identified the source of the sound and we've reduced it by 40 to 50%. So it's a way to quantify that data instead of just waiting for the noise to come. And so that's pretty much the basis of my research. So who are the players? The car constitutes your airway. The police officer would be the physician. So he stops you and tells you that something's wrong with the airway. And he sends you off to the mechanic, who's the surgeon. And the surgeon will permanently fix your airway for you, make sure that the noise doesn't come back. So you're probably wondering now, what's the noise then? In this case, the noise is defined as obstructive sleep apnea. And obstructive sleep apnea is pretty much when your airway closes either partially or completely closes off during sleep. So partial closure is identified as a hypopnea, whereas a complete closure is identified as an apnea. And a recent study actually showed that because obstructive sleep apnea is on a spectrum, you could have mild, you could have severe. Mild can range all the way as little as snoring, for example. It could affect 1/7 of the global population. And the more severe cases, which are limited, they link to cardiovascular disease, diabetes, and even a reduced lifespan. So spinning off the course. So specifically what we're looking at here is, this is the airway. This is a regular airway. So you can see we have good airflow through the oral cavity into the oropharynx. So we identify this part of the airway as the retroglossal airway, retroglossal meaning behind the tongue. And so in cases of sleep apnea, we actually see a reduced airway volume, and we see the soft palate actually closing off that airway, not allowing any air to flow from the oral cavity or the nasal cavity through the airway, which is, as you probably realize, a big problem. So what's the fix? The fix that the mechanic used is called maxillomandibular advancement surgery. So this is a permanent solution to OSA. You might have heard it as double jaw surgery. It boasts an 87 to 100% success rate. And essentially what it is an advancement or the protrusion or pushing forward of the lower and upper jaw. So the lower jaw is your mandible and the upper jaw is the maxilla. And so clinical success is based on the apnea-hypopnea index, which is pretty much what I was alluding to earlier. So you, after MMA surgery, you're sent to a sleep clinic and they identify how many times your breathing stops or slows in the nighttime. So this is an example of MMA surgery. So again, this is the mandible. So what we do is we bisect the mandible at the area of the ramus. So this is the ramus of the mandible. And we attach this device called the distraction device. And then from there, you can turn this mechanism. It's kind of like an Allen key, and advance the mandible forward by increments of 2 millimeters. And so as you can see afterwards, if you push forward the mandible a couple millimeters, you have protrusion of the jaw. And what we see is before MMA, again, we have that diminished retroglossal airway space. But after applying the surgery and pushing forward the upper and lower jaw, then we see this enlarged retroglossal airway volume. So we increase the volume in the retroglossal airway. And again, this distraction device is also used on the upper jaw, the maxilla. And so, as I've said with the sleep study, the clinical success of MMA is defined as less than 20 apnea-hypopnea events or a 50% reduction in the observed apnea-hypopnea events. So our group wants to propose, we want to essentially look at how maxillomandibular advancement surgery decreases that apnea-hypopnea index. So we've recently shown that MMA increases the retroglossal airway volume, but what does that mean for respiratory mechanics? So because of that, we want to analyze the incremental effects on MMA surgery on airway resistance. And then we also want to quantify its effect on facial appearance, which I'll get into a little later. So our first aim is to assess both inspiratory and expiratory airway resistance in cadavers following 2 millimeter increments of maxillomandibular advancement from a baseline of 0 millimeters. So how we propose we're going to look at that is with a pretty rudimentary setup. So we have what's called a bag valve mask, which I'm sure you've seen paramedics use in the field to manually ventilate patients. And essentially what we have is we have attached MMA to cadavers, and we're able to leave the distraction devices in there so we can push forward the jaw as little or as much as we want. And then we manually ventilate these cadavers. And as we manually ventilate, the information about the difference in pressure of the airway and of the flow rate through the airway get picked up by what's called a pneumotachometer and a pressure transducer. And then that information is digitally outputted onto a laptop. And so this is just a quick summary of a pneumatochometer. So you can see that as the flow goes in, it picks up the difference in pressure, and that's just outputted onto a laptop. Not really too much to look at there, but what's important is that we're measuring inspiratory and expiratory pressure, and we're also measuring flow. And so from there, we can calculate airway resistance, because resistance is just a function of the change in pressure over flow. And so it's sort of a stepwise mechanic. How we plan to do this is we plan on applying this apparatus before applying MMA to see the resistance before we actually undergo MMA treatment, and then also afterwards. So we want to see if just applying the MMA apparatus in general changes these variables. And after that, from a baseline of 0 millimeters, we will slowly increment the upper and lower jaw advancement by 2 millimeters and keep measuring the airway resistance at each level. And so that will hopefully give us a function. We expect to see that as volume increases, so as you push forward the jaw, we see a decrease in airway resistance. And so once we get to a maximum of 14 millimeters, we'll go back down from 14 to 0 and identify if the change in resistance will then increase by the same amount that it decreased. So our second aim is to then measure the areas and degree of facial alteration in cadavers following the same 2 millimeter increments of MMA from baseline. And so how we plan to do this is we take a 3D mesh of the face. And so again, this is done as we're measuring the airway resistance. And so I'll get into why we do that later. But essentially at baseline and from before MMA to after MMA and each 2 millimeter increment, we will use the Artex Space Spider 3D scanner and constitute a 3D mesh of the face. And what that does for us is just a quick warning. So the next slide is just going to include cadaveric scans. So if you're squeamish or anything like that about cadaveric scans, I'd look away now. But essentially what that does for us is then we can utilize these 3D meshes and we can put them into a statistical software called RStudio and superimpose the images on each other. And what that does for us is it creates a heat map of the advancement. So this was probably an image of the face from baseline or right after applying MMA apparatus. And then you can see that as we push forward the jaw, as we advance the MMA apparatus, you can start to identify the areas of advancement. So the cooler colors here identify more areas of advancement. And so this superimposition helps us to identify specifically what areas are being moved and the degree that they're being moved by. And just to kind of clarify, this area we're talking about is called the mandibular soft tissue because it's all the soft tissue that overlies the mandible. And so what's the big picture? In general, we're looking to construct a relationship between advancement and resistance. So hopefully we could say if we advance the jaw by 6 millimeters, we would see a 40 to 50% reduction in airway resistance. Simultaneously, we want to measure the impact on facial alteration. And so that's important because facial aesthetics is important to patients because if you push forward the jaw 10 millimeters, for example, it's going to cause a lot of changes to how they look. And so we want patients to be able to have a say in that. And so by measuring the facial alteration while we're doing advancement, we could see also that if you advance the face 6 millimeters, then we're going to see changes in these specific areas. And so what happens is down the line, we're hoping that this will guide surgeons in preparing for their surgeries. So before they even begin the surgery, they can tell the patient, where we want to advance the mandible by 10 millimeters, we'd see a reduction in airway resistance between 80 and 90%, but this is what your face is probably going to look like. Or subsequently, we can also do a 6 millimeter advancement. We'd only see a 40 to 50% reduction in airway resistance, but you'll see your face looking like this, which is a lot less of change. And so we want to quantify that in our research. So in the future, again, this project hasn't been started yet. We actually start our research in June. So I'll start to begin data collection starting then. So in the meantime, I have to complete cadaveric ethics and I need to practice with the apparatus. So making sure the bag valve mask setup works and making sure that all my variables are being properly measured. And so that's a bit about my research. And so down the line, what I'm really interested in, and I'll talk about kind of the different pathways that people in my program take. As I've alluded to earlier, I'm interested in medicine. So I plan on applying to medical school starting this September. But other frequent routes in our program, people undergo a PhD in clinical anatomy. It's kind of like the next step to our master's in clinical anatomy. A lot of people undergo further research fellowships, so they get jobs in the research field. A lot of people, as I've said, start to teach. And so what's cool is we actually have ties with a Caribbean medical school called the American University of the Caribbean School of Medicine. There was actually a recent graduate from there who just got an internship with them. It's a 2-year thing, and they go down to the Caribbean and they teach the med students anatomy, which is really interesting and unique. And then a lot of us go to professional school. So as I've said, I'm interested in medicine, but you can also go through dentistry. And there's a lot more. If you're ever interested in the program, you can feel free to reach out to me. I'd love to talk about this further. And so just to sum it up, I want to thank my supervisor, Dr. Tim Wilson. I want to thank my committee, Dr. Shimizu, Tassi, Louis Ferrara, Dr. Kat Wilmore, Mr. Jeff McQuaid. They kind of helped me shape my project and ask the right questions to get me thinking about the right things. I want to thank the CRIP lab members. Even though they're undergoing different projects, we all get together every week and make sure our presentations and our knowledge on our subjects is always in tip-top shape. And I want to thank, again, the ACBC and CAS for bringing me on. I've had a really good time talking to all of you, and I hope this is interested in you in research. And again, if you're ever interested in my program or the research I do or want to talk about any of this, you can feel free to reach out to me. I can include my email. It's kwolfstadt@ua.ca. And at this point, I'd like to take any questions.
Hi, Kody. Sorry, I think this can't really see everyone. All right. Well, thank you so much for your presentation. Yes, if anybody has any questions, please just unmute or add them in the chat, whichever works best. So I'm not sure if you can see the chat, but somebody asked if you had any tips or tricks for getting research experience.
Oh yeah, absolutely. Sorry, I just opened the chat now. I can see that. So what I realized that for getting a research experience, it's not really enough to just send an email. What you really want to do is inquire of any potential research project, or if you identify a lab that you really like what they're doing, the best thing you can do is reach out to the supervisor or to someone in the lab and just ask for a 15-minute chat. And so you don't say that you're interested in joining the team. You just say, hey, I want to talk to you for 15 minutes and let's just discuss sort of your research and I want to learn more about it. And then from there, they start to talk about your research. You see if you have an interest in it. And normally when you get someone started about their research, they end up talking for an hour about it. And then you can kind of, you can then tell them that you have an interest in joining the lab. And at that point, they'd be happy to help you out. So the biggest advice I can give you is just reach out, look for a 15-minute conversation over Zoom, or if we didn't have a pandemic, I'd say go into a coffee shop for 15 minutes and sit down. But taking that first step and getting them down for a one-on-one, get your name in the door, and it helps you to get into the position that you want to get into.
Thanks so much. Yeah. So do you want me to read you the questions or can you see the chat now?
I can see the chat now.
All right, fantastic.
Yeah, so factors or criteria that I considered when choosing between grad programs. So again, I have an interest in medicine, and so I was looking at the program that kind of best encapsulated all of my interests. So this program I thought was great because of that, because it incorporated my love for anatomy through dissection labs, which is very unique. There's only a handful of people who get to explore the body doing cadavers, one of them being med students and dent students. So that really spoke to me. The teaching experience, again, teaching is a great skill, not even just to be a teacher, but down the line, just by being able to communicate any research experience or by communicating your findings. So a big thing about me is that I wanted to be a surgeon specifically. And so I have an interest in developing or enhancing surgical techniques. So the teaching aspect of that would allow me to hopefully have my lab one day and communicate findings, and make sure that everybody in my lab is up to speed with the anatomy. And so that's a really good skill to have. And then research experience is just great. I really like the idea that everything that you find is unique, it's novel. No one has ever done it in the world, which is really cool to me. And so this program kind of took everything that I want to do. And so that, I think that's the best advice I can give you, is just write down what you're looking to get out of a grad program. And then as you're looking through them, make sure that each one has what you're looking for. And the mixtape dropping on Spotify somewhere 2022 probably. Pandemic's kind of slowed that down. What are key things you did in undergrad to get where you are now? So one thing that I wish I did in undergrad that I didn't do was to get research experience early enough. So I only got research experience the summer after my third year. So the best advice I can give you is to get your foot in the door early. Try to identify potential research positions and just get as much experience in the field as you can as early as possible, because that's only going to help you and open up more doors to go down. Like the big thing about research experience, it might not even be just the research itself, but the people you meet can have a big impact in helping you get to where you are. So even being just references or contacts in different programs. So again, like for this grad program, I didn't know anybody going into it. I didn't know anybody into it, but I reached out ahead of time to one of the profs, and I sat down with him for 15 minutes, and I had an interest. We talked for like an hour. So that's probably one key thing that I did in undergrad, is just get some research experience. And I wish I did it earlier. And another thing that I did to get to this master's program is I would say to be mindful of what you want to do. So I know it's tough to kind of figure out where you want to go and what route you want to go down. But if you can try to figure out a little bit what you're looking for down the line, you can start to plan and research potential pathways. And then at that point, you have a better idea of what you want to do. And then you can be proactive enough to go out and do it, essentially. Yeah, so manual ventilation. So as I've said, I don't know if I can bring up my slide. So we're assessing airway resistance using a bag valve method strategy, which basically means I'm going to be manually ventilating these cadavers and making them breathe myself. And so that can have a consistency issue, because who's to say that I squeeze too hard or don't squeeze enough? And so one way to counteract that is by categorizing our data. So my supervisor and I came up with a method where we would potentially use a metronome to time the squeezes in a bag. And then we can use one category as a low flow group, in which it takes 3 seconds to close the bag and identify the resistance at the low flow variable. Or we can do, we can also do a high flow variable in which we squeeze the bag, for example, 1 second. But hopefully we're working with Dr. Jeff McQuaid, who's a respiratory therapist, and we're hoping he can get his hands on a transport ventilator. So ventilators are obviously really in use right now because of the pandemic. So we're hoping he can maybe get his hands on an older one that's not certified for use right now, and could potentially automatically ventilate our cadavers. So those are the pitfalls, and those are kind of the strategies we've taken to identify them and hope to fix them. Do you think I have more resources? Yeah, so I'm not sure how it is with COVID right now, but a lot of research program, or a lot of grad programs in general, they do look for research experience. Not to say that you need research experience. I'm not sure which programs require it and which don't, but it's always beneficial to have research experience, and specifically to have as much research experience as possible. And so COVID makes it very difficult, for example, to do in-lab stuff, but I'm sure there's people out there who are doing systematic reviews. So for example, I was doing the systematic review on total hip arthroplasty, in which I didn't have to go into a lab. I basically worked with me and another master's student at the time, and we would identify which articles we believe would fit our research question. And then we would compare to see if we have the same ones, and all of that's done online. And then data extraction, all of that we can do over our laptops. So it is difficult. I know COVID definitely limits the amount of research positions, but if you try to look for systematic reviews or any type of research in which you can just do on your laptop, it's even more beneficial. Um, so in terms of your question, Kanav, do they care about the field of research? So certain programs might. I know ours didn't. I have research experience in an organic chemistry lab, and now I'm doing research on the jaw and respiratory mechanics. So I did have a systematic review on total hip arthroplasty. So I did show that I have a knowledge in the field, but generally they just want to see that you have the research skills and experience. They don't care more so about what the content was, because at the end of the day, what you're getting out of research the most is the skills you get, the communication, the organization, the time management, the leadership, all of that, working with a team. That's what's really most important in research, because if you don't know how to do that, then you're not going to be successful in the lab. So just getting any sort of research experience is helpful. Um, so again, to answer your question, I don't know. Some grad programs might care, but generally I don't think they would.
Sounds good. Thank you.
Yeah, no problem.
Kody, I actually have a question for you.
Yeah.
So you mentioned the like Ryerson science program at the very beginning that you attended. Is it like a conference or a program?
Yeah, sorry.
Sure, but
I think I did.
the question was more so, I'm sure that there are probably students who are interested in similar things. So could you maybe share like more knowledge about how to find opportunities like that and your kind of overall experience maybe?
Yeah, so this was a conference, a local conference at Ryerson University called Science at the Interface, in which a lot of master's students in the science field and PhD students, they presented their research. So there was two parts to it. There was a poster presentation, and then there was small 5-minute thesis presentations. And so I was doing mostly data collection, and so it was actually our master's student Zainab who was giving a 5-minute presentation on her thesis. And then Melissa was also doing a poster, and Fawaz was also doing a poster. And so this was kind of an event that all master students were expected to participate in. And I had the pleasure of going just because not only did I actually volunteer to set up the posters, but I had a slide in Zainab's presentation. And so it was cool to see my data collection, my duck graph, for example, up on the big screen. And so the best ways to kind of get involved with this stuff is just to be proactive. I know that there's different places where these events are posted all the time. I know I get about 100 of them in my UO email. So it's just being proactive, talk to people in the research team, just chat with people. I'm sure people who are actually undergoing their research right now are probably preparing to present. So just by reaching out to people and seeing kind of where their research is lying and where they're going to present, you can get your foot in the door and get involved with some of these conferences, or even just, like I said, volunteering. So even though I wasn't technically presenting, I reached out to the coordinator of Science at the Interface and just asked if I can help with poster presentation, because by then I could interact and mingle with the master students, the PhD students, the professors, and it was really cool to kind of pick their brain about their research. And it was a great way to sort of network. And even though I haven't used any more organic chemistry links, they're always good to have in your back pocket.
Yeah, thanks so much for sharing. I just have one other kind of more fun question, but what would you say is your favorite thing about research?
My favorite thing about research, I think that just the feeling of discovering something novel is really, really cool. So even though I was in the organic chemistry lab, I was just a undergraduate student. I was just doing data collection. I came up with this graph, and it not all of them look like that. A lot of them didn't have this reversible sweep or the oxidation sweep. And so once I finally got this was like a textbook image. And I was really, really proud that I got this data, and it actually ended up in the presentation, and a lot of these scans ended up in the paper. And I just that feeling of novelty, that feeling that you were the first person to ever discover this and share it with the world, and to have the world be interested in it, it's really unique. and it's something that you can find, and even doing the little parts of research. So I'm really looking forward to doing that with my research project, because I have a lot more of a leadership role now. This is my project, and the committee kind of works with me. So I'm excited to get that started, and hopefully present this research at the annual anatomy conference that is presented both locally and internationally, I believe. I know my supervisor was hoping for me to do that. So just to answer your question, I think the novelty of it, just that feeling of excitement that you were the first person to do something.
Yeah, thank you. So I'm not sure if there are any other questions, but if people do want to ask you anything, where can they reach you?
Yeah, so I'll put that in the chat. Sorry. My email is kwolfstadt@uo.ca. So that's that. You can feel free to reach out to me at any point. I'm pretty active on my email. I might take a day to answer your question, but I'll always reply. I promise. Some days I have lab days, so I might be busy. But if you have any interest in my program, my research, or if you have any questions about getting into a graduate program in general, reach out to me, and I'm happy to answer any and all questions.
All right, well, thank you so much. We won't hold you up anymore. I know you said you have a crazy day today. So thank you again for joining us. And to everybody else, we'll be having another session next Thursday with Dr. Tyler Beveridge, and we'll be sending out more info for that. So otherwise, thank you so much to everybody for coming, and we'll see you next week.
Yeah, thank you very much. Tyler's a good guy, by the way. He's gonna have a lot of fun. He's a prof in my program. We all like him.